Looking at your legs these days and feeling frustrated? The constant cramping, that shaky feeling when you stand, the fear of falling. I get it. And if you're like most seniors, you've probably tried vitamins, maybe even done some light exercise, but you're still struggling. Hi, I'm Dr. John DeMarco, and over my 15 years practicing nutrition and preventive medicine, I've seen thousands of patients dealing with weak legs and arthritis. Today, I want to share something that might surprise you. The solution isn't just about finding the right supplement or doing one type of exercise. It's about understanding how your body works as a complete system. Here's what I've learned from working with patients in their 50s, 60s, 70s, and beyond. Weak legs and arthritis pain aren't separate problems, they're connected. And when you address them together with the right approach, you can see real improvements in as little as 23 weeks. Today, we're going to break down a gentle 3-step plan that's helped my patients regain their confidence and mobility. We'll cover specific exercises that strengthen your legs without stressing your joints, anti-inflammatory nutrition that works from the inside out, and lifestyle adjustments that protect your progress. But first, let me address something important. Many of you have been told that exercise will make your arthritis worse, or that once your legs get weak, there's not much you can do. That's simply not true. Recent research from the Arthritis Foundation shows that gentle, targeted movement actually reduces joint pain and stiffness while building the muscle strength you need to stay stable. The key is knowing what to do, how to do it safely, and in what order. That's exactly what we're going to cover today. Step 1. Gentle exercises to rebuild leg strength. Let's start with the foundation building strength in your legs without putting unnecessary stress on your joints. I want you to think of your leg muscles like a support system for your joints. When these muscles are weak, your joints have to work harder, which means more pain and less stability. Here are 3 exercises that I recommend to almost all my patients dealing with weak legs and arthritis. First, let's talk about walking. I know it sounds simple, but there's a specific way to walk that maximizes benefits while minimizing joint stress. Start with just 10 minutes daily. The key is consistency, not intensity. If you can, try Nordic walking poles. They engage your upper body and improve balance. According to research from Hinge Health, regular walking improves circulation, reduces morning stiffness, and actually helps your joints produce more lubricating fluid. Second, seated knee extensions. This one is perfect if you have severe arthritis or balance concerns. Sit in a sturdy chair with your back straight. Slowly straighten one leg, hold for 5 seconds, then lower it down. Do 10 repetitions per leg. This exercise targets your quadriceps, the muscles at the front of your thigh that are crucial for walking and getting up from chairs. These muscles often become weak first, which is why so many seniors struggle with stairs and standing up. Third, calf raises. Stand behind a chair for support. Raise up on your toes, hold for 3 seconds, then lower down slowly. Repeat 15 times. This exercise builds strength in your calves and improves ankle stability, which is essential for preventing falls. Many of my patients are surprised how much their balance improves just from stronger calves. Now, I want to address something important here. You might be thinking, Dr. DeMarco, won't this make my arthritis worse? The truth is, gentle movement like this actually reduces arthritis pain over time. When you don't move, your joints become stiffer and more painful. But when you move them gently and regularly, you're helping them stay lubricated and healthy. Start with these 3 exercises, doing them every other day. As you get stronger, you can gradually increase the repetitions or time. The goal isn't to push through pain, it's to build strength gradually and safely. Step 2. Anti-inflammatory nutrition for joint health. Now, let's talk about what you're eating, because nutrition plays a huge role in both leg strength and arthritis management. Many of my patients are surprised to learn that certain foods can actually increase inflammation in their joints, while others can help reduce it. Think of inflammation like a fire in your body. Some foods are like gasoline, they make the fire worse. Others are like water, they help put it out. When you have arthritis, you want to eat more water foods and fewer gasoline foods. Let's start with the anti-inflammatory superstars. Omega-3 fatty acids are probably the most powerful anti-inflammatory nutrients you can eat. You'll find them in fatty fish like salmon, mackerel, and sardines. If you don't eat fish, walnuts and flax seeds are good alternatives. Aim for fatty fish twice a week, or a tablespoon of ground flaxseed daily. Antioxidant-rich foods help fight the oxidative stress that contributes to arthritis pain. Think colorful fruits and vegetables, berries, leafy greens, bell peppers, and tomatoes. The more colorful your plate, the more antioxidants you're getting. Now, let's talk about the foods that can make inflammation worse. Processed foods, especially those high in refined sugars and trans fats, can increase inflammation throughout your body. This includes things like packaged cookies, fried foods, and sugary drinks. I'm not saying you can never have these, but try to limit them. Excess sugar is particularly problematic. It doesn't just affect your blood sugar, it can actually trigger inflammatory responses that make arthritis pain worse. If you're drinking regular soda or eating a lot of sweets, this could be contributing to your leg pain and stiffness. Here's one practical tip you can start today. Replace one snack daily with an anti-inflammatory option. Instead of chips, try a handful of walnuts. Instead of a cookie, try some berries. Small changes like this can make a big difference over time. I also want to mention hydration. Many seniors don't drink enough water, and dehydration can actually make joint pain worse. Aim for at least 8 glasses of water daily, more if you're active or it's hot outside. Step 3. Lifestyle adjustments that protect your progress. Now let's talk about the lifestyle factors that can either support or undermine all the good work you're doing with exercise and nutrition. Weight management is crucial, but not for the reasons you might think. Yes, excess weight puts more stress on your joints, but even small weight reductions can make a significant difference. According to Medical News Today, losing just 10 pounds can reduce knee pain by up to 50 in some people. The exercises we discussed earlier, combined with anti-inflammatory eating, often naturally lead to modest weight loss. Sleep quality is something many of my patients overlook, but it's absolutely crucial for recovery and pain management. When you don't sleep well, your body produces more inflammatory chemicals, which can make arthritis pain worse. Plus, poor sleep affects your balance and coordination, increasing your fall risk. If you're having trouble sleeping due to joint pain, try these strategies. Keep your bedroom cool and dark. Avoid screens for an hour before bed, and consider a warm bath with Epsom salts before bedtime. The magnesium in Epsom salts can help relax your muscles and improve sleep quality. Heat and cold therapy can be incredibly helpful for managing arthritis pain and supporting your exercise routine. Use warm compresses or take a warm bath before exercising. This helps relax your muscles and makes movement easier. After exercise, if you have any swelling or discomfort, ice packs can help reduce inflammation. Proper footwear is something many seniors underestimate. Wearing supportive shoes can improve your balance, reduce knee impact, and prevent falls. Look for shoes with good arch support, cushioning, and a non-slip sole. Avoid flip-flops or worn-out shoes that don't provide adequate support. Stress management is also important because chronic stress increases inflammation throughout your body. This can make arthritis pain worse and interfere with your sleep. Simple techniques like deep breathing, gentle stretching, or even just spending time in nature can help reduce stress levels. Creating your action plan. Now, I know this might seem like a lot of information, but I want you to remember that you don't have to do everything at once. The key is to start small and build gradually. Week 1. Choose one exercise from step 1 and do it every other day. Add one anti-inflammatory food to your daily routine. Week 2. Add a second exercise and focus on staying hydrated throughout the day. Week 3. Include the third exercise and try one new stress reduction technique. Week 4. Evaluate your progress and adjust as needed. You might be surprised how much better you feel. Remember, everybody is different. What works perfectly for one person might need to be modified for another. The key is to listen to your body and make adjustments as needed. Important safety notes. Before we wrap up, I need to emphasize something important. While these strategies are generally safe for most people, you should always consult with your healthcare provider before starting any new exercise program, especially if you have severe arthritis or other health conditions. If you're taking medications for arthritis or other conditions, some of the anti-inflammatory foods we discussed might interact with your medications. For example, if you're taking blood thinners, you need to be careful about dramatically increasing your intake of leafy greens. Your doctor can help you navigate these considerations safely. Also, if you experience increased pain, swelling, or any unusual symptoms while following this plan, stop and consult your healthcare provider. The goal is to feel better, not worse. Your path forward. I want to leave you with this thought. You don't have to accept weak legs and arthritis pain as just part of getting older. Yes, our bodies change as we age, but that doesn't mean we're powerless to improve how we feel and function. The combination of gentle exercise, anti-inflammatory nutrition, and smart lifestyle choices can make a real difference in your quality of life. I've seen it happen with countless patients over the years, and I believe it can happen for you too. Start today with just one small step. Maybe it's a 10-minute walk, or choosing berries instead of cookies for dessert, or doing 5 seated knee extensions. Small actions, taken consistently, create big changes over time. Your legs carried you through decades of life. With the right approach, they can continue to carry you confidently into the future. You deserve to feel strong, stable, and pain-free. This 3-step plan is your roadmap to get there. What's one thing from today's discussion that you're going to try this week? I'd love to hear from you in the comments below. Share your plan, ask questions, or let me know how these strategies work for you. Remember, I'm here to support you on your health journey. If you found this helpful, make sure to subscribe for more science-based health information specifically designed for seniors. And check the description below for links to additional resources on arthritis management and fall prevention. Until next time, take care of yourself, and remember it's never too late to start feeling better.